Thank you, listeners, for joining us for today's Wellness Wednesday, brought to you by Vitality Integrated Program Services, the VIPs for Complete Behavioral Health. Today's guest is Dr. Michael Thompson. He is the medical director for the VIPs and a diplomat of the American Board of Psychiatry and Neurology. Dr. Thompson, welcome to the program today. We're going to discuss men's mental health.
All right. Thank you, Lori. I'm glad to be here to talk about this. It's a very important subject.
So why is it important to discuss men's mental health, Dr. Thompson?
Well, for a long time, there has been this stigma about men seeking help for any kind of mental health issues. Growing up, a lot of times men were taught things like, boys don't cry or be a man. And it's been learned over the years to just kind of keep emotions to yourself, not really talk about any issues. And unfortunately, those lessons from childhood kind of stick around with many men. There was a recent study that 40% of men said that they would never talk to anybody about mental health issues. And that's something that just needs to change. Over their life, about 2 out of 5 men are going to be experiencing symptoms of major depression. Compared to women, men are about 3.5 times more likely to die from suicide and 2.5 times more likely to die from an alcohol-related illness. Yet they're 3 times less likely than a woman to actually ever seek any help or any treatment for these things. Those are things that we're looking to try to change the course on.
Well, thank you, Dr. Thompson. Obviously, in our community and from surrounding communities, people can find help through Vitality Integrated Programs for Complete Behavioral Health. We are a certified community behavioral health clinic in our community at 215 Bluffs Avenue. You can call 775-777-VIPS. That's 777-8477 to schedule an appointment. Can you tell us how mental health may have been impacted by the COVID-19 pandemic?
Oh, definitely. So obviously, the COVID pandemic affected everybody, without a doubt. We all had to kind of get used to new situations, and most people were pretty adaptable, I've learned over time, but there was a lot of people that really just did not do well with all these changes. 75% of men felt that there was an increase in stress levels that they were having to deal with during COVID, and obviously there's a lot of factors there. Many people went through losing their job. Many people lost a loved one to COVID. There was a lot of people that had a great fear about getting sick. The shutdowns that we all went through had a great impact. Many people, including about 60% of men, felt very isolated during those beginning parts of the pandemic. It's tough for a lot of guys. Many guys have friendships that are very activity-based. Maybe they see people at a church basketball league or they go bowling with them. Those were all things that were basically shut down for several months, and so that really impacted their ability to have some of those social interactions with people. For many guys that lost jobs during the pandemic, a lot of men feel that their sense of purpose, their self-worth is very much tied into their jobs. And so when they lost their occupation there, definitely impacted how they were doing from a self-esteem standpoint and from a mental health standpoint. For many people that were already seeking help or they were wanting to seek help, they were on that verge of making that phone call. A lot of offices closed down and it became really difficult to find therapists and doctors during that time, and it became a little bit of a delay to try to provide mental health for people. COVID also saw an increase in drinking. A lot of alcohol use skyrocketed during COVID, which is not the greatest coping skill when you're dealing with a lot of stress and anxiety and depression. These are all things that are starting to change, and luckily we're also seeing an improvement in people reaching out and trying to get help. And luckily, and I'll talk a little bit later, that that stigma for trying to reach out to get some help for mental health issues for men is starting to come down a little bit, which is great to see.
And Dr. Thompson, among the issues we're describing, how can you tell if you or if there's a man in your life that might need to talk to someone about their mental health?
Sure. It's, depression in men is a silent epidemic, doesn't always get talked about. That stigma is getting a little bit better to try to address it. Over the last decade, there's been several celebrities and athletes that have come out and talked about their own struggles with mental health. Comedian Pete Davidson, who's on Saturday Night Live, has talked pretty openly about his anxiety and depression and trauma he's been through. NBA All-Star Kevin Love's talked about the issues he's dealt with anxiety and how it's impacted his basketball career. And I think the biggest supports come from Olympic champion Michael Phelps. He's discussed very openly depression, anxiety, and substance abuse issues that he's dealt with. And he's really been a big advocate for men's mental health and mental health in general. He's helped sponsor a talk therapy app you can use on your phone. So as more and more people are talking about men's mental health, I think it's going to be easier for people to address it and realize that maybe I should talk to someone about it. As far as trying to help people close to you, a lot of times it is someone's wife or their mom or their daughter who kind of pleads with them to kind of make that first step. That's pretty common to see when I'm talking to a guy in the office. They'll say, well, my wife was noticing this or had this, concern about things. So it's definitely important to definitely talk to the guys in your life if you have any concerns about it. There's definitely typical signs of depression you might see, talking about feeling sad, having crying spells, sleeping too much, sleeping too little, changes in appetite. It can be a little more challenging with men. Sometimes you see some symptoms that you may not see in women. Look for different changes in work performance that are coming up without any real explanation. Look for changes in wanting to do things with people, a lack of pleasure in things that they used to want to do. Now they're isolating away from people when they used to enjoy hanging out and seeing friends on a regular basis. They're turning down invitations to go hang out with people. A lot of physical symptoms, too. It may be easier for someone to talk about their head hurting or their stomach hurting instead of saying that they're anxious or worried about something. So little things like that are things that should be picked up on. If you feel like you have someone that would benefit from getting help, start by trying to find a therapist. It can be a counselor. It could be a pastor. There's options at Vitality that could definitely be helpful for therapy. There's also options online. There's a lot of different people that provide services through apps and whatnot. So there's definitely options out there. They just need to be utilized. If the things have gotten a little bit more concerning and maybe you need to look at a step beyond just having a therapist to talk to, there's doctors that can definitely help you in looking at maybe medication options if therapy is not providing enough benefit. If you feel like there's someone in danger and you feel like there's a risk that they may hurt themselves, please help convince them to go to the emergency room and get seen there. That can actually save a life in the long run. So if you do feel like there's someone that needs help, please intervene. Don't be afraid or embarrassed to talk about it. Those stigmas are coming down, and you're definitely going to feel better providing help than looking back and wishing you would have provided help.
Well, thank you, Dr. Thompson. These are all very important points for families in our community. The Suicide Prevention Lifeline is 1-800-273-TALK. That's 1-800-273-TALK, 8255. Dr. Thompson, are there things that men could be or should be doing to improve their mental health?
Definitely, without a doubt. I think the first thing we're doing is, we're just talking about mental health, which is great. And I appreciate you, Lori, for bringing this up and having an outlet to talk about men's mental health. In November, we usually talk about men's overall health, physical health. We have things like Movember or the No Shave November, which is supposed to bring awareness to men's health. And then in June specifically, we're focusing on mental health. Just having things devoted to this to be able to talk about it comfortably and give us an outlet to talk is great. There are definitely things that everyone can be doing to help improve mental health. I'm going to focus on the men out there, but a lot of these things go for everybody. First off, just check on the guys in your life. This goes for men and women. Check on your dad, check on your brother, your friends, your son. Have conversations about how they're feeling. make it very comfortable and normal to talk about feelings, and whether you're worried about something or if you're feeling down. There was a survey that looked at engineers, a very male-dominated field, and it said 1 out of every 5 had lost a colleague to suicide. And those are the kinds of stats, when you hear that, it just makes you realize that if they would have been more comfortable talking to their colleagues and opening up about experiences, maybe things could have been a little better. So hopefully over time that's going to make a difference. For guys, stop marginalizing how you're feeling. Don't say things like, I'll just deal with it, or I don't want to be a burden on anyone. Talk about your feelings. What you're feeling is real, and you're able to kind of accept it, and don't undervalue what you're going through. Definitely, as the pandemic has taught us, things can get pretty stressful around us, and you've got to find ways to bring those stress levels down. I would encourage everyone to get regular exercise, get some kind of activity every day, take a walk, go dancing, do something fun to just gets the blood pumping a little bit. Get a journal, get a notebook, and just journal about how you're feeling. Sometimes if you don't feel comfortable verbalizing it, putting it into paper with a pen can definitely get those feelings out too. Carve out and devote time for things that are important to you, whether it's hobbies, having a family game night that you're doing regularly, making time to see your friends and not letting them fall by the wayside. Definitely limit your alcohol intake and limit the amount of time you're on social media. I think so much of what's out there we assume is reality, when there's so many things that just aren't true out there. We see people living lavish lifestyles, or having these incredible fitness routines that no one can keep up with. Just remember that those things aren't real, and to take a break from social media when you can. And just remember, if you're doing all these things and you still feel like you're struggling, reach out to someone, whether it's family, a therapist, or a doctor. Just make sure you're having some in-depth discussions about mental health, and hopefully you'll feel like things are going in the right direction.
Well, Dr. Thompson, what a kind and thoughtful man and professional you are. Thank you so much for sharing all of this wisdom, this great advice, and really, this heartfelt advice with all of us, because sometimes, it's easy to feel isolated in Elko, but I know that you're, as the medical director for VIPs, you're available to the Elko community and have been for about a year. So thank you.
Thank you so much, Lori, for giving me the opportunity to talk about this subject.
And thank you, listeners, for joining us for Wellness Wednesday. Remember, you can find help at the VIPs, our certified community behavioral health clinic for wraparound services, complete behavioral health, at 775-777-VIPS. That's 777-8477. And thank you, Dr. Thompson.
Thank you.